So welcome to today's webinar. Throughout the course of the webinar, we aim to provide further information for organisations that might be considering embarking on their journey towards gaining accreditation with UKAS. As Laura says, my name's Crystal, and I have been with UKAS for nearly 9 years now, the first 8 of which was spent in the healthcare section, accrediting organisations to ISO 15189. My background pre-UKAS is in microbiology, and I moved into development in February as an accreditation specialist, and now working my way through the training process, etc., in development under Louise's guidance as head of development. Throughout the session, as Laura says, we'll have the question and answer function open. So any comments or questions, please raise them there and we'll address them at the end, at which point Louise will come in to also assist with question and answers. If there's any we're unable to answer, we will get back to you very shortly with an answer to any queries. So a couple of weeks ago, we did the previous webinar, which was the purpose of accreditation, whereby we went through who UKAS is, what is accreditation, what the value of accreditation is, the assessment process, and how you how you apply for accreditation. The webinars are part of a series that will repeat regularly throughout the year, and the third session will run in December, which goes into more detail about the role played by assessment managers within UKAS and how they will be your point of contact through your accreditation journey. So today's webinar, obviously I said it was to provide you with information and resources on the next steps in your journey once you've determined that accreditation is right for you. So we'll go through, is accreditation right for yourself? Is your business ready to proceed with accreditation? How you begin your application. We'll go through the assessment process, pre-assessment, initial assessment, how we approach the assessment and what we expect from yourselves during the assessment, any findings that may be raised and what the process is, and then how you maintain your accreditation. So what the future looks like once you've been granted accreditation. We will touch lightly on accreditation costs and then what next. So is accreditation right for you? So obviously, before you apply with ourselves, it's important to consider whether accreditation is the correct course of action for your business. In some areas, to gain contracts, etc., accreditation might be mandated in those contracts. Others, it might be desirable. It gives you almost a kind of area that not everybody has, so it gives you a kind of bonus area for your customers, and it'll give you a one-up, if you like, in the market. So as an organisation, it's up to yourselves to determine if accreditation is right for yourself. Accreditation is voluntary. We don't mandate it. It's not regulatory. So have a good think, and if you decide it's something that you're ready to consider, we'll obviously look at the benefits of accreditation. So accreditation can highlight gaps or weaknesses in your operational capabilities, and therefore provides opportunity for improved organisational efficiency and outputs from your organisation. It provides independent assurance of technical competence that, as I said, can set you apart from the competition in the rest of your field. The assessment process that accompanies accreditation can also help assess, identify and reduce risk within your organisation. Global recognition provided by accreditation increases international acceptance for import and export and can break down barriers to trade. Because of mutual recognition agreements through the likes of International Accreditation Forum, International Laboratory Accreditation and European accreditation, having UKAS accreditation can aid in the removal of technical barriers to trade. As you see on the side, there's some survey results there of those that responded and felt what the benefits to accreditation were. Accreditation creates a confidence in industry supply chains and is often specified by public and private sector organisations as a prerequisite for acceptance. Examples for mandatory accreditation for certain activities can include forensic services in the UK, being accredited at 17020 or 17025, as well as being reviewed against the regulator's code of conduct and code of practice. Areas like asbestos regulations and asbestos testing does need accreditation, and again is reviewed against 17025 and an approved code of practice and guidance. And screening services for healthcare, we assess for UKHSA the programs for infectious diseases in pregnancy and kind of inherited metabolic diseases, thalassemia and sickle cell, those kind of areas. And the government does require these are accredited. Accreditation provides confidence to employees, customers and stakeholders of a commitment to quality and service improvement. And it can also help support the generation of new business, potentially providing expanding access to new markets and regions. So is accreditation applicable to me? If you provide any of the following services below, you can become accredited with UKAS, for example, testing, certification, calibration, and the list goes on, as you can see. So UKAS does provide accreditation for organisations for a range of different services. It's important to establish whether accreditation is applicable to your business and to the sector you operate within. UKAS accreditation is granted to organisations that have demonstrated they fully meet the requirements of relevant national and international conformity assessment standards. If you are a testing, calibration or medical laboratory, or you provide certification, inspection or validation and verification services, then accreditation is likely to be relevant, if not essential for your business. Accreditation is also applicable in a number of healthcare fields, such as physiological and imaging services, medical physics and clinical engineering, biobanking and proficiency testing. Finally, accreditation is applicable to producers of reference materials in a number of sectors. The next step is, once you've decided to start your accreditation journey, is to purchase your relevant standard to the activity that you're seeking accreditation for. Standards can be purchased from the BSI website or from ISO directly. Some healthcare standards, such as the Physiological Sciences standard, are freely available. Accreditation can be granted to a specific standard. A conformity assessment body can be accredited to a number of standards for various different activities. So you can either hold one accreditation to one standard or numerous. Standards are formulated by a group of experts. These include both British, European and globally recognised standards. These standards will outline the requirements that must be met by organisations to succeed and deliver their services safely and effectively in line with accreditation. Standards define best practice in many different areas and come in a number of different formats. So is your business ready? So during the early stages, UKAS will work with yourself as an organisation to establish whether your business is ready for accreditation. And if not, what options are available to start preparing you for accreditation? So UKAS provides various resource materials to determine whether your business is ready to apply for accreditation. Before you begin your journey, there's a few things we recommend you do. These include making sure you're really, really familiar with the standard and that you are meeting the requirements set within that. Equally, make sure you're familiar with any support and publication associated with the standard. One of the things you can do is ensure you subscribe to UKAS's monthly publications newsletter. This informs you of any essential information about new publications, revisions of publications, withdrawn publications, and documents that are inviting consultation. If you look on the UKAS website for these publications, you'll always ensure that you get the latest version. We also have self-assessment readiness tools, which have been developed especially for organisations considering application to a number of standards. These are free online tools available on the UKAS website, which will help testing and calibration laboratories considering accreditation identify any gaps in the requirements of the standard and their current operating status. There's also some being recently developed for the certification world as well. The UKAS Training Academy can also offer a range of courses which are relevant to all accreditation standards in order to help organisations prepare for accreditation assessment and also enhance knowledge of the standard for quality professionals in all the sectors. A full list of available training courses, including in-person, virtual, on-site, where we can deliver at your own premises, and e-learning options are available on the UKAS website. So to help in your journey, you should identify the relevant support and UKAS publications, which will be required to gain accreditation. International publications that are also relevant to your area of accreditation are available on the EA, IES and ILAC websites. Support and publications and technical content can also be found on the UKAS website. And as I said, you can sign up to receive monthly updates, which come in the form of the publication updates that you see on the right-hand side of the screen at the minute, which will keep you current with publications that are necessary in your field. So as I said, we've recently developed the Readiness Self-Assessment tools, and these are designed to support conformity assessment bodies operating across a range of sectors on their journey to achieving UKAS accreditation. And there's a number of different standards that they exist for, as you can see listed. You can access these via the UKAS website under Readiness Self-Assessment tool. They comprise a set of questions which are designed to allow organisations to check their current policies and systems against the expectations of the relevant standard. Against each criteria, there are 3 potential responses: yes, no, and somewhat ready. The organisations can use these to describe how closely they feel they've met the requirements of the standard. The readiness assessment tool is best completed by individuals within the organisation who have a good understanding of how the organisation manages and performs its technical activities, and also personnel who are responsible for aspects of quality and customer management. Whilst training isn't a mandatory requirement for gaining accreditation, it can be useful in enhancing the knowledge of some of the more complex areas of the standard, or providing the tools and techniques to fill in the remaining gaps and ensure your systems and processes are developed in line with the requirements for accreditation. As said, we have training courses available across certification, healthcare, inspection, laboratories, verification and validation, amongst many other areas. The UKAS Academy trainers who run these courses are current or previous senior assessment managers. So there's opportunity whilst on these courses to ask very specific questions in relation to the standard. What we don't do in these courses is answer questions unique to your organisation, because we've got to be very careful we don't cross the line between discussion and consultation. As I said earlier, training is available in a number of formats, including on-site at your company's premises, and this can all be discussed with the training department within UKAS when inquiring. So, you've decided to apply for accreditation to the relevant section and standard that covers your area of the market. So at this stage, you download relevant application forms. You've got to complete the correct application form, which will include details of what you've got to submit, key policies and procedure documents, and proof of legal status, which you need to submit to ourselves to ensure swift processing. Supporting materials include relevant application form. There's a list of around 10 application forms, but it's very clearly indicated which application form is for what on the website. any management system documentation, signed copy of UKAS agreement, and payment of any application fees that's required. Organisations that are based outside the UK should contact sales@ukas.com in the first instance before submitting any documentation or fee. So once the application is submitted, UKAS will process this internally. You'll receive an acknowledgement email with a reference number, and you'll also be informed of which section you've been allocated to and when to expect a call from UKAS. During the introductory call with the section head in the relevant department, you can discuss your application and any questions you may have. You will also have an assessment manager allocated to you at this stage. Once your application is submitted and all fees have been paid, your assessment manager has been assigned, the assessment process can then begin. So the first stage is application review, and we at UKAS review our ability to carry out the assessment of the applicant in terms of its policies and procedures, the competence we hold within UKAS to assess your field, and the availability of personnel suitable for the assessment activity and decision-making process, again from a UKAS side. This review will also include the ability of UKAS to carry out the initial assessment in a timely manner that works with customers' expectations, and where the initial assessment cannot be conducted in a timely manner, this should be discussed with the conformity assessment body that's applying for that relevant area. So let's spend a little time looking at pre-assessment. So the value of a pre-assessment is that it allows you to meet your lead assessor or assessment manager that's been assigned to your case. Familiarises both ourselves with your team at the organisation, and it'll familiarise yourself with the assessment process. It allows you as an organisation ask relevant questions relating to what the initial assessment will look like, what the team will look like, and it provides an impartial external perspective on your processes and procedures and can identify possible areas of non-conformities and gives you the opportunity to fix them before you move further down the assessment process. So some common areas identified during a pre-assessment, which makes it beneficial for the customer to have this information early, is that sometimes there's misunderstanding of some requirements within the standard and or the specific sector schemes within that. Normative requirements within the standard are sometimes missed, or normative requirements can be incorrectly determined as of applying to the organisation. We often find that relevant international mandatory documents haven't been implemented. There may be a lack of implementation of processes and policies. Practice may not match documented policy and process, and the business is doing the right thing but lacking the documented evidence required to prove that. And obviously the earlier we identify that with yourselves, the better, because it gives you a chance to fix these areas before moving on. So conformity assessment standards generally share the following common elements. There's normally general requirements, then structural requirements, resource requirements, process requirements, and management system requirements. And they generally all follow the same process. The management system requirements, again, generally include, but may not be limited to, the management system itself, documentation, implementation, and then how you maintain that management system. Document control, record control, how the organisation deals with non-conformities and corrective actions, how the organisation seeks improvement or actions to address risks and opportunities, the internal audit process, and management review. So once we move on to initial assessment, what does that look like? So we have an opening meeting, which will take place to agree the arrangements between yourselves as an organisation and the assessment manager. The assessment will involve a detailed review of records, systems, processes, and overall competence of the organisation to meet the requirements of the standard. Interviews will take place with staff and managers, as well as witness and key activities with personnel. A full vertical and horizontal assessment will take place that covers the entirety of the standard that you're seeking to be accredited for. A debrief of the assessment and any findings will be discussed with the customer at a closing meeting, and UKAS will then provide a full report shortly afterwards, following the accumulation and gathering of the entire team's reports into like I say, as a full report for yourselves, which will detail any findings, including any improvement actions that were identified and agreed with by yourselves to meet the accreditation requirements. You will also be asked to advise UKAS on how you will address them. It's up to the organisation to provide the improvement action that will address the non-conformance. So there's various ways in which an assessment can be delivered, and the assessment approach will be agreed ahead of delivery with the customer. So UKAS uses both face-to-face and remote assessments. The later technique being developed was during COVID-19 lockdown periods where we couldn't actually get out to site. The vast majority, I must say, of initial assessments are face-to-face on-site assessments. UKAS determines the assessment approach based on a risk-based approach to the assessment and what that looks like. A blend of face-to-face and remote assessments can enable improved focus and efficacy. A lot of the assessment activity can be conducted offline via document review and submitted prior to assessment to make things more efficient, so that we're not wasting time on site looking at documents with yourselves that we could have reviewed beforehand. The need for assessors to see the customer work environment and the availability of appropriate ICT are significant aspects that will need to be considered in determining if a remote assessment will be feasible. So, assessment findings. So first off, what is a finding? So the UKAS team will identify both positive and negative findings. The latter, the negative findings, are referred to as non-conformities. So in that case, what's a non-conformity? A non-conformity is the failure to meet one or more requirements outlined within the normative requirements of a standard. UKAS refers to these as mandatory improvement actions. So the process of findings is obviously the UKAS assessment team inputs the mandatory improvement actions into a report into the UKAS assessment portal. Where this isn't possible, complete an online report at the time of assessment. An offline improvement action report is provided, and then we upload it later into the portal afterwards when we've got access. So the customer is required to upload to the UKAS assessment portal details of the outcome of their root cause analysis and determination of the extent of the non-conformities, what action they took to correct them, and then supply evidence of this action being successful. The portal submission, together with the support and evidence of actions taken to address the findings, needs to be completed within the specified time frame. At initial assessment, this is 12 weeks. Once you gain accreditation, it's subsequent surveillance visits, that's 4 weeks. So UKAS will then review the submitted information and supported evidence to determine whether the customers addressed the non-conformities it raised in a satisfactory manner. And feedback will then be provided to yourselves on the outcome of the review, usually within 4 weeks of receipt. So there's a decision-making process within UKAS that needs to be followed. Once the assessment's been conducted, there's a requirement that there's an independent decision made by one person or a committee who are independent of the assessment, and they'll review the report, confirm whether the recommendation in the report is appropriate, and then whether a grant of accreditation can be awarded. The process gets split into 2 stages, a provisional decision and then a final decision. As said, the decision-making process is 2-stage. Typically, the first stage is completed once we've been on site to the head office and that assessment is complete. The second stage is then completed once all of the assessments have been completed and all non-conformity evidence has been submitted and accepted by ourselves as correct and verified. Output from the decision-making process includes confirmation that accreditation can be granted. It then issues an e-certificate and schedule of accreditation, which includes the whole scope of accreditation that the customer has been applied and offered accreditation for. Once the customer has been accredited, they can then use the appropriate symbols of accreditation in accordance with defined rules. So accreditation symbols, you can see examples of below. Once you're allowed to use these symbols, you can visually display your accreditations through using these in activities relevant to the accredited activity. So you can only use the symbol when it's relevant to things that are on your schedule of accreditation. UKAS is licensed by the Department of Business and Trade to use and confer these national accreditation symbols, which signify government recognition of the accreditation process. We do encourage all customers to use the national accreditation symbols for promotional purposes and will provide yourselves with a condition of accreditation logo and symbols and how they can be used, and that's available on the UKAS website. If you trade overseas, you're also able to use the ILAC or IEF mark to signify global acceptance of the accreditation. Listed on the slide here are some examples of the rules which govern the accepted use of symbols. So you can use it on certificates and reports, on any kind of quotations that may go out. You can display your symbol on internal walls and doors, exhibition stands, on your website, but you may not use the symbol on vehicles, built outside of buildings and flags, the goods and products themselves, and any primary packaging. So as you've gone through all the hard work of gaining accreditation, we do recommend you promote your accreditation. So UKAS has produced a variety of materials to promote the benefit of using accredited services such as those you provide. That can be downloaded, distributed or hyperlinked to support quotations or direct marketing by yourselves, and all can be accessed from the UKAS website. There's promotional videos, which are a set of videos that promote accreditation, and you can find these on UKAS's YouTube channel, which can be linked to or embedded on your website to show customers the benefits of going with yourselves as an accredited organisation. And you can also subscribe to UKAS's YouTube channel to receive alerts as new videos are added. There's World Accreditation Day, which is held on the 9th of June each year. The event's organised by ILAC and IEF and is promoted by the standards, metrology and conformity assessment community. You're encouraged to use the materials produced for this awareness day to promote your accredited status to your customers and stakeholders. Theme and materials are published on the UKAS website and social media channels near the day. So once you've been accredited, you've got your certificate, how do you maintain your accreditation? This includes any surveillance and reassessment activity that may take place. So we're looking at the latter end of this slide. So you've already been granted your accreditation. So you then go into the continuous quality improvement cycle. You have a surveillance at year 1, surveillance at year 2, surveillance at year 3, and then a reassessment at year 4. These can be done via a variety of assessment approaches, as discussed earlier, via remote or on site. But the aim is that through the entirety of the 4-year cycle, we'll cover your entire accredited scope again. And then at year 4, post reassessment, hopefully we'll be in a position to renew that accreditation as you've proved you're still meeting the requirements of the standard. So, there's things accredited organisations can adopt to assist them and maintain their accreditation. You can inform your assessment manager of any changes that you feel may affect the scope of accreditation. You obviously have to maintain your technical competence, ensure you keep up to date with any regulatory changes within your sector. You can subscribe to the updates in the UKAS publication bulletins to ensure that you're receiving the latest up-to-date accreditation requirements. Inform UKAS in advance of any relocation of premises or relocation within the same premises from which accredited work is performed. You have to maintain your internal audit regime, ensure ongoing effective document control, and retain required quality records and technical records throughout the periods between assessment. As I said, your assessment will be confirmed, your accreditation will be confirmed on an annual basis through surveillance activities with a full reassessment every 4th year. The first surveillance assessment will take place 6 months after you receive that email granting you accreditation. So 6 months after the grant, not 6 months after the initial assessment. It must be assured it's 6 months after the grant. At initial assessment stage, before you're granted, you will be provided with an estimate of the potential cost and effort involved for the 4-year cycle. To gain accreditation, you must accept that estimate of work. And at any time during the life of your accreditation, the estimated effort may change. For example, if you want to add more activity to your accredited scope through the extension to scope process, you'll then be provided with an amended estimate at each stage, and a quotation will be received before every surveillance and then reassessment activity. So, what does accreditation cost? All assessment fees are effort related, so therefore they depend on the complexity of the scope and of the accreditation being sought. These fees include not just the time the assessment team spend at your site, but also the office time beforehand, reviewing documents before they come on site, planning the visit, booking the visit, organising the team, etc. And also the office time after the visit, whereby we're writing the report, the improvement action report, providing them to yourselves, and then there'll also be a fee for any evidence review and close out of findings that may have been raised on a visit. There's a list of current fees which can be found on the UKAS website under the standard and on the standard terms of business. So the following slides can provide an indication of cost. Typically, the larger the scope that the customer has, the more assessment time is required. There will be an annual fee. Assessment types, as I said, there'll be fees for pre-assessment, initial assessment, and then separate ones for surveillance and reassessment. And the fees that we're looking at from a scenario point of view, you look at, if we take, for example, a small testing laboratory, you've got a relatively small scope of activities you perform, e.g. you may just work in a single technical sector like soil analysis. Typical application fee is £1,500. Pre-assessment generally falls within £3,500 to £5,500. There's an initial assessment, £7,500 to £11,500. Annual ongoing surveillance, £4,000 to £6,000. And a reassessment can be between £6,000 and £9,000. Please note that any costs that are listed on the UKAS website are exclusive of VAT, so this needs to be taken into account. So, if you're interested in proceeding with accreditation, the first thing you need to do is get in touch with UKAS. There's a number of a number of ways to get in touch with UKAS. You can either use the contacts on the slide here. However, if you ring any UKAS department, they will be able to put you through to the right person who can assist with your inquiry. Alternatively to calling us, you can contact us through the website with the contact form that's on there, and somebody will be in touch to discuss your requirements. Are there any questions? And at this point, Louise and Laura will pop their cameras back on. So Laura, over to you.
Hello there. Right, thank you so much, Crystal. I know that's an awful lot of information to get through, covering a lot of points there. So I really appreciate that. We have had a question, only the one though. So if anyone does have any questions they want to raise, please do drop them into the Q&A section, and we will get to them. The question we have had is quite an interesting one, actually. Someone has asked, do you have a set time to pass the accreditation process? And what they've said is to clarify, can you fail? So I presume they mean that once you've actually embarked on saying we want to be accredited, is there a time that they have to actually gain their grant of accreditation before they kind of get kicked out of the system, I suppose?
Yeah. So I'll start with that, and then Louise can add anything if required. So when you submit that application form to us, we generally say that we would need to be on site within 2 years at a maximum. So some organisations submit the application form and then say, right, well, we're going to prepare ourselves now. And they're then in danger of breaching that 2-year mark, at which point the application will be removed and the application fee will have been lost. So we do say that apply when you're ready to be seen within. I would generally work at a year. I generally work at a year to ensure that you get the whole activity covered. Once we've been on site and done the initial assessment, we leave you with a recommendation. Now, that recommendation is either yes, through what we've seen in the assessment we've just conducted, the customer is in a position to proceed towards grant of accreditation. So we will recommend accreditation to the relevant standard based on the successful satisfactory closure of any findings raised. That then has to be agreed by an independent decision maker to check that the assessment manager's recommendation is based on sound evidence. And then that obviously proceeds with the clearing of the findings. You get 3 months to clear the findings, and then move on to accreditation. Should you not clear the findings in 3 months, and that drags out for a protracted period of time and puts into doubt the recommendation, an extra visit may be needed at that point to reconfirm to UKAS that the requirements of the standard are still being met. So that time period will be discussed with your assessment manager should there be any problems closing them findings. The other recommendation is that we've done the initial assessment and we don't feel we're in a position to recommend accreditation. Now, at that point, we'll have discussions with yourselves about why we haven't felt we can offer accreditation, what has gave us concerns, where the risks are, etc. At that point, time periods can be discussed for us to come in and do a repeat assessment, which will be chargeable, or indeed the customer might decide at that point that it's too far from where it needs to be, and it may want to withdraw its application until it's in a position to apply and hopefully at that stage be successful. So whilst we don't say you fail the process, there may be a situation arises whereby we wouldn't recommend accreditation, but that doesn't automatically halt the process. We still work with you to get you to a position where hopefully you will be recommended accreditation, but there will be subsequent costs at that stage. Louise, do you want to add anything to that?
I think you've covered it all really well. The only thing I would say is, yeah, we don't use the word fail. We might say you'd need a further assessment. The areas that are left, or the gaps and the weaknesses that we've identified with you on an assessment, mean that we're not in a position to be able to see all of the areas of your conformance or your compliance yet. So there's work to be done, and we would work with you, and we would then arrange to do another assessment with you when you'd address those findings and come and do it again. But yeah, the 2 year period, it's more that it's 2 years to see some progress. If you're getting there, you're applying, you're working with us, we've done perhaps some document reviews, and you're working towards that accreditation, and we can see that you're working, then that's absolutely fine. But if we don't hear from you within 2 years at all, and nothing happens, then probably we'd be saying, are you able to continue? Let's close this until you are. But the key to all of that is to communicate with us as to what your needs are, what your timeframes are, what you need us to work with you to achieve. And if there's time for you, then please do let us know. But certainly we don't use the word fail. We look to how you can meet those requirements.
Absolutely. I'd just add as well that a lot of customers, when we're on site doing the assessment, start to panic when they see the number of findings piling up. What I will say is it's not the number of findings, it's the risk associated with those findings. So organisation might get 60 findings, but there might be really minor ones like the header on a document's not correct, or this hasn't been closed and it's a week overdue. There may be little findings. However, another organisation may only get 3 findings, but the real showstoppers, the real risk-heavy findings. So that's what we'll consider when we make the recommendation. So don't think, oh, well, we've already got 40 findings, this is going to be a definite no at the end. That's not the case. It's the severity of the finding.
Yeah, absolutely.
Thank you. As always, we've now had a flurry of questions come in, so I should try and work through these in a sort of sensible way. What somebody has asked a question which I believe probably is about scope. So they've given an example. Can an organisation accredited under ISO IEC 17020 for the transportation industry serve as an inspection body in the medical industry? Or does it need to obtain a separate accreditation under 17020 for the medical sector? And if so, what is the process?
Yeah, that's a really good question. I'm afraid the answer is the classic UKAS answer of it depends. So if your processes for the transportation industry are going to be exactly the same in the process that you'll look to inspect within the medical industry, then absolutely you can use your accreditation for your inspection to do that. That's absolutely fine. We'd need to look at it and make sure that we update your schedule so that you can publicise that and use your schedule as your shop front window, as it were. Now, if the activity is different, you can still be accredited for it, but we would need to assess that with you and understand what the technical differences were, what the procedural differences were, and what the outcomes might be that might be different. So we would discuss that with you, and we may need to do what we call an extension scope, which is adding another activity onto your schedule. But it really is, it depends. Is it the same thing with a different label on it? Absolutely, that's no problem. Or is the actual technical activity different, in which case it could still be accredited, but we'd need to discuss that with you, understand it, and assess it so that it can go onto your schedule of accreditation.
Thank you. Somebody has asked a question just following on from the previous one regarding failure. At what point does the number of minor findings equate to a major finding, as the number of minors is indicative of a global or major failure of the system in place?
We don't do that anymore. For quite a few years now, we just raise them as mandatory findings. So we did used to do that, and I think it was if we had 5 or something in a certain area, then we would minors, we would upgrade it to a major. We don't do that at all anymore. So either an activity is met, it meets requirements, or it does not. So we write a finding that is mandatory, so that it means that it's something you need to do to comply with the standard, and that's full stop. So we don't do any of that. It's either meets requirements or it does not. The only other classification of finding that we have is what we call a recommendation. So that's something that might be a potential weakness that we think might cause a potential issue in the future, or actually just a suggestion of, do you know what, you're doing an awful lot here and you don't have to do all that. And we might recommend that you can revisit it and perhaps save yourself some time or effort, for example. So there's only two categories of findings: a recommendation or a mandatory finding, which is something you need to address in order to comply with the standard.
Thank you. We've got a question about POCT. So what are the benefits of having POCT accreditation? And can a specific POCT device be accredited but not the entire service?
Right, so I'll take that one. So obviously most of point of care testing falls within healthcare. So I'll kind of go down the healthcare route. So if you want point of care testing accredited, that's absolutely something we can do. Now, it depends on what the customer requires. So some customers have point of care devices out in the community. They have them on a dozen wards, a dozen clinics. They have them everywhere. And they may have lots of different devices measuring different things. So they might have things that measure blood gases, things that measure blood sugar, things that measure INR, say kind of blood drug monitoring, etc., etc. The customer chooses what they want accrediting. So a lot of customers choose to start off small and go, well, you know what, we're just going to choose blood gases and we're just going to choose them on hospital wards. Once we've got the processes assured there, we'll then apply for external things that's out in the community, etc. Once we've got that done, then we'll add on the INR machines, then we'll add on the blood glucose machines. So it's up to yourself to decide whether you want to go big and want the entire scope accrediting for every point of care you do, or whether you want to do it small. What I would say benefits of point of care testing is that as a laboratory, you can control how those devices are used. You can control the training that's given it's given to other wards, departments, facilities, so that you know they're using them properly. You manage the maintenance of those analyzers, so you ensure they're doing what they see on the tin. You manage the quality assurance of those, so you put known value samples through there to ensure that you're getting expected results. You can control who sees the answer to those results, therefore who's going to act on those. And at any point, if they're not being done in a way you feel is accreditable and up to your usual high standard of quality assurance, you can withdraw that ability from those areas. So what it does, it ensures that you have a real grasp of the quality assurance of those areas. Benefits that come from that, obviously, you can offer that testing at any of your areas that you might want, be it in the community, be it in clinics, be it in kind of GP surgeries. There's a community nurses taking it into people's houses. You can offer that point of care testing service, which obviously gives you an advantage over laboratories that can only test things that are accredited in-house, in their lab. Point of care testing used to be a separate standard. It's now included within ISO 15189-2022, and you would apply for point of care testing using the normal extension to scope process if you were already an accredited customer. If you're not an accredited customer already, you just state on your application form you want point of care testing as well as laboratory testing, and that's something we can offer. Hopefully that's answered your question.
I think it has. Hopefully it has. Somebody's asked, is there a code of conduct for assessors, I presume assessment managers, and is it published for CAB? For CAB, it says, I think they probably mean, is it available for CABs to view that code of conduct?
absolutely is a code of conduct which all of our staff would sign up to before we use them. That includes identification and declaration of any conflicts or relationships, confidentiality and behaviour and conduct, as you would imagine. What I'm struggling is it up? Is it available on the website? I'm not sure on that.
No,
you know,
I don't
I
know the
don't think it
answer to
is.
I don't think
No.
it is. It might be. I can check the customer area. Is it possibly available through the portals, Louise?
It might be. I think we'll have to come back to you on that one because I'm not sure. But I can reassure you that there most definitely is, and we monitor all of our staff on a regular basis for their behaviours as well as their technical know-how and their delivery of the assessment process as well.
Absolutely. Also within the updated UKAS agreement that you sign with ourselves, not only does it list our expectations of you as the customer, it also lists what your expectations can be of us. And if at any point there's any queries about the performance or the behaviour of a technical assessor or the team, your first point of call is your assessment manager to discuss what those issues are. And also, if you have issues with your assessment manager, you can contact the section head in any section. But we absolutely have to sign a code of conduct. And as Louise said, we all get yearly monitoring to kind of renew our competence, and we get observed throughout that process. So yeah.
Lovely. Someone's asked a question around the actual assessment process. So they've said, what do the team and manager interviews usually involve during assessment? What sort of questions should we be prepared for?
Right, well, I'll start and cover from a accreditation standard point of view, and then Louise can cover from a certification point of view. So basically, the way the assessment works is usually the technical assessors go out into the area that they're assessing, and they'll speak to the personnel on the lab floor, the ground floor, if you like, who are actually performing those technical activities. And they'll stand and they'll watch and they'll wait until the person's done the activity, and then they'll say, well, why did you do that? And do you know why this is part of the process? Just general kind of gaining an understanding that that person's got a competence in that area. And it's all done in a very friendly kind of chat. It's not a sit down grilling interview. It's absolutely very much I'll stand next to you and I'll chat along to you, and you can tell us why you're doing what you're doing, because you were the best person suited to do that. The other side of the assessment is the quality management system side of the assessment, and that usually involves a quality manager sat with the lead assessor in a room with the management system. So be that an electronic quality management system like iPassport or QPulse, or be it a paper-based one where we're sat surrounded by files that shows how you do what you do. And literally it's can you show us where this is stated to show you meet this requirement, or how do you think this works well, and how do you think this meets the standard? And it's very much a two-way interactive chat. Again, it's not a sit-down interview and you're grilling you with a list of pre-prepared questions, which can sometimes become confrontational in its approach, if you like. It's very much a working together to get us the information we need. Occasionally, we do need to interview key personnel, and that will be listed on the visit plan. For example, we may need to interview a finance person or an IT person, or your laboratory director, your general manager. And that'll just be to see what role they play, are they aware of the roles and responsibilities, what meetings do they attend, are they aware of the current state of play of their business, how they interact with the team, is there a communication pathway between the staff personnel that's doing the job and the higher management. It's very much a two-way thing. It isn't a grilling. It isn't sat with three of us across the table from you, asking you to say why you did this and why you felt that was acceptable. That's not the way the assessment works. If it worked like that, we wouldn't get the best out of yourselves as an organisation and indeed out of our team. So hopefully that allays any fears. Louise, from a certification point of view, it's pretty similar.
It is similar. I think I just add that what we're looking to develop with you, and that relationship, particularly with your assessment manager, is really, really important, that we get to know you, you get to know us, and we can develop a partnership so that we're there to understand your organisation and make sure that we understand what your challenges are, what your concerns are, and if we can help with that as well. I had a lab many years ago that used to call me Miss Show Me, because apparently that was one of my favourite phrases, and that's the kind of questions we'll have, which is, can you show me where the records are for this? Can you show me how you adhere to this requirement? Can you show me your organisation chart? And those are the kind of questions we're going to be asking, which is kind of, you give us the information, you tell us how you comply with that standard. We're not looking to catch you out. We're looking to confirm your conformity and your compliance. So it's really important that we put you at your ease, and that's very much part of our process, is to make sure that your staff and yourselves feel comfortable, enabled to enable them to do that, so that we all get the best out of the assessment. And our technical assessors, whether they're witnessing a certification audit, an inspection audit, or they're with you in a laboratory or any way, are going to be doing that to try and get the best out of everybody, and get the information that we require to give us that confidence that your competency is there, your impartiality is there, your quality management systems are in place and implemented and a part of daily routine. So that's what we're looking for, is that confidence that everything is there. Yes, sometimes we do literally have a sit down with a cup of coffee and tell me about this particular customer or this particular event, talk me through these case files, and have that conversation. But generally it's more, tell me what you're doing, tell me why you're doing it, where are the records, that, and show me where it's written down. So those are the kind of questions you're going to see, and that covers any kind of assessment process for any of the standards, really.
Thank you. Also, I should say we've got the role of the assessment manager webinar taking place this Monday coming, just after the weekend, and that's probably could be of interest to anyone who's interested in, you know, what the assessment manager does. We do focus on that in how to sort of get the best out of your relationship with your assessment manager, so that could be useful. So I'm just going to drop the link to that in the general chat there, just in case anyone's interested. I think we have time for one more question.
Yeah.
We've got one here. I'm not sure how we would answer this, or whether this is UKAS's place to answer, but I will say how it is. As the world of POCT testing is continuously growing, will there be any plans to make POCT accreditation mandatory in the future?
So
Go on, Crystal.
I find it unlikely that they would make point of care testing mandatory, as the standards that usually use point of care testing themselves are not mandatory in a lot of cases. So with regards to if it developed into areas that are mandatory, for example, asbestos testing and forensic testing, if point of care testing became available there, then it probably would become mandatory, because it would fall under areas that are mandatory. Until laboratory testing standards become mandatory and dictated by a regulatory authority or government, I think it's unlikely that point of care testing would become mandatory.
And it's unfortunately, it's not our call either. That will come from Department of Health, or NHS for that as well.
Yeah, it would come from a higher authority, and it would be their decision to request UKAS started to help with accrediting point of care testing. Obviously, we would always recommend that any organisation that does do point of care testing absolutely gets accreditation to go alongside its laboratory activities, because accreditation is obviously that marker of assurance. And we would always recommend that. There's not many point of care testing accredited organisations. And I think the reason for that was that it used to be a separate standard. Whether it'll be taken up more often now that it's merged into the 15189 standard remains to be seen. But I would always recommend people did seek point of care tests and assurances.
Yeah. Thank you. So I think that brings us to the end of the questions now, and we've just finished just slightly over time. But again, thank you so much to Crystal and Louise for your time and your expertise in answering these questions. Really appreciate it. And thanks again to everybody who's given their time this Friday afternoon to learn a little bit more about UKAS accreditation. The webinar recording will be sent around next week. We do have that other assessment manager webinar available on Monday as well. And then we'll be redoing the whole series in December. But for now, thank you very much. And I shall bring it to a close.
Perfect. Thanks, everyone.